these conversations with KIPDA. My name is Mia Anderson. I am the program manager for KIPDA's Connect program. Today we have with us Dr. Suzanne Mitchell. Dr. Suzanne Mitchell is an MD entrepreneur and innovator in health technology. For over a decade, she has designed and researched the use of immersed telehealth to increase patient engagement and chronic disease management. She's completed her research at Boston University, funded by more than $5 million in NIH awards. In 2018, Suzanne founded See Your Health LLC, Yourself Health LLC, an early-stage startup established to bring immersed telehealth to the more than 36 million people living with diabetes. Her vision is to restore good health and hope for people struggling with chronic disease by helping them become high-performing partners in care. Suzanne is an expert in the field of patient engagement and is an award-winning innovator in this space. She is board certified in family and palliative medicine and is an associate professor at the University of Massachusetts Medical School. She is also a champion and advocate for efforts to reduce health inequalities, including her own work in health services research. Suzanne graduated from Wake Forest University School of Medicine. Suzanne enjoys living with her family on the North Shore of Massachusetts. Welcome, Suzanne. How are you today?
I'm terrific. Thank you so much for the opportunity to be here, Mia.
Thank you so much for joining us. I know that you've done a lot, as I just said in your bio, but could you tell us more about the why and what journey has brought you to the current work that you're currently working on, and more about your current work?
I would be happy to. Thank you so much. I think probably my story begins early in my life when, I first wanted to be a performer, but I think my parents didn't see a future, or how would I support myself as a musician. And I struggled to figure out, well, what else could I do? But I think at the center of my motivation was really a call to serve. You see, I was raised by nurses, and I grew up watching my mom and my older sister, not only take care of other people, but really be an important resource for my family. My family, I came from a working class family in the Boston area. And I can remember growing up, and my mom was like the family expert on medicine. She had this Merck manual that she would pull out from 1948 when she was trained as a nurse during World War II. And she would look up ailments and give family members advice. And I watched that at her knee growing up. And then I would shop with her in the grocery store, and women would run up to my mom. She was a labor and delivery nurse, and say, they called her Mitch. They'd say, Mitch, you were there with all my kids, and I'll never forget how you took care of me at that time. And I think that left a lasting impression on me. And so, but I also didn't think, I thought, to become a doctor, you have to be kind of born with that mission, and you had to kind of be on that path. And here I was, already in my mid-20s. And then I learned about a program for, they call it now, post-baccalaureate pre-medical training. And so I completed that at a program in Cambridge at Harvard University. I did my pre-meds after I had completed a bachelor's degree in business management. And from there, I went to medical school at Wake Forest University in North Carolina. And that was a really interesting and transformational experience, because I encountered at Wake Forest in North Carolina a lot of migrant farm workers who had trouble navigating the healthcare system through language barriers, and they would come into the hospital and nobody could communicate with them. And I saw a really important need not only for language services, but for all kinds of other social determinants that affected their outcomes. And that was kind of my first introduction to social determinants of health, which has played an important role in pretty much the rest of my career. And I thought that I would go into the Peace Corps and go to Central America and provide what we call cradle-to-grave care in international settings. But then I went to Los Angeles to become fluent in Spanish and learn full-spectrum family medicine at White Memorial at the Adventist Health System. And it was also a transformational experience working immersed in a community within our own country that had so many challenges and language barriers and unmet social needs that affected people's ability to have basic health care. And I started to ask a lot of questions. And I think that I was trying to understand, why did my patients have to work so much harder to get the care they needed? And why did I have to work so much harder to help them get it? And that led me down a path to public health. And I started looking at public health. How do you know when there's a public health problem? And I learned a valuable lesson. If you see something and you're trying to figure out if it's a real problem, just count how many times you run into it. And for me, it was first mental health, how people couldn't get mental health services, and second was the really emerging epidemic of obesity, and especially in young children, and chronic disease that was disproportionately affecting my patients in important ways. And so I got a master's degree at UCLA, and I decided I wanted to study that. And that took me down a pathway to really trying to understand, how does the healthcare system work, and serve people in different ways. And so I went back home to Boston. I got married and came back to Boston. I had my husband and my son. And in that time period, serious illness touched my own family. And my husband was diagnosed with a very rare cancer. And we had a very personal experience with healthcare that also shaped my perspective on how the healthcare system works, but also in ways that it doesn't work. And I realized that what's so important when people face a serious illness and diagnosis is that they participate in the decision-making and that they become partners in care, not just recipients, not just passengers, because at the end of the day, you are the one that has to live with the consequences of a treatment decision. And I feel like that is a really important time for people to decide what they want, because it's not always the same thing that your doctor wants or that the insurance company is offering you, and you really have to be an advocate for your own needs. I don't know, Mia, am I on the right track with this testimony?
I love everything about it. Yes, it's a very personal journey, and I think it directly relates to it gives the perfect perspective of how you ended up exactly now where you are with your work with See Yourself Health. Like you said, looking at personal public health problems and counting how many times you're able to encounter those things. I can see how that would bring you to the work that you do now. Tell everyone more about the work that you're currently doing now with See Yourself Health.
Yeah, so I came back to Boston and I started working at Boston Medical Center, which is the largest safety net hospital in New England. And I started doing research on health services, gaps in care there. And my first project was called Project Red, and that was looking at hospital readmissions. And we started working with technology, trying to figure out how we could help people learn their discharge education better and be better able to implement it at home. And what I learned through Project Red was how important teaching people how to take care of themselves after they leave the hospital is, and how little emphasis we put on it at the time of discharge. We do it really fast. It's really complicated. People don't feel well, and it really sets them up to come back to the hospital because of avoidable complications. So I started to realize, if you want to solve a big problem like hospital readmissions, and you have a simple solution, which is to teach people how to manage it better in a way that they can understand, that's a really excellent opportunity for innovation. And we just needed to figure out how to make it more relevant and affordable and implementable. And we started using testing technology, really innovative technology, not really the things that most people are familiar with. But at the time, we were using these what we call conversational agents, where you talk to a computer character, and the character is trained to help you understand your educational needs, how to take care of yourself with a chronic disease or after you've been in the hospital. And I really didn't think people would accept that, but because the agent was very empathic and said things to you that made you feel like you could trust the information, like the character was also helping you feel understood and cared about, people actually preferred to talk to the character named Louise than to talk to a busy doctor or nurse who really acted like they were in a hurry, because they are, and didn't have the time to repeat information until you got it right. And I think that was really appealing to people, that they would be able to learn what they need to know and listen to it over and over and over until they got it right. And so it opened my eyes to the potential for technology, human-computer technology engagement. And so I did another project called Women in Control, and that was looking at group-based care, so people working together on diabetes. And again, I was skeptical that people would be willing to participate in this kind of care in this animated environment, but I was happily surprised. We were working with middle and older-aged adult women who were the heads of their households, and they had type 2 diabetes, and diabetes runs in families, so we were trying to help serve the heads of households, these women, and so that they could share that knowledge and wisdom with their families. And I was amazed. We were using animated avatars in a 3D animated environment, so think, like a video game kind of experience, but we're not playing games. We're doing really serious work, and we're engaging together. The avatar is customized to reflect how that person wants to look. They talk to each other, and they learn through doing, this interactive learning experience, which is much better for adults than sitting and listening to information. We want people to take their knowledge and put it into action. And to do that, they need to practice. And so we wanted to help people have better tools to put that into action, not just knowledge, but skills, and also, most importantly, the support of one another to get through the difficult times that you experience when you're first trying to deal with a chronic disease and when you're trying to change your lifestyle. And the Women in Control participants, there were over 400, they were just amazing. We also delivered in Spanish, and they loved the experience. And as long as they were given the resources and the training and the support, they were enthusiastic users, and their health got better. They supported one another. They had fun, and that was just a really powerful experience. And because my initial experience was that good research goes out into the world, then I started to look for ways to take this new resource, this potential tool, platform, to other partnership with a health plan in Pennsylvania, Geisinger Health Plan. We established See Yourself Health. We did some demonstration studies how we needed to improve the technology so that it would be ready for people to use. And then we got funding from the NIH, the National Institute on Aging, to create a platform that was designed specifically for people who often don't have that opportunity to have technology designed just for them. And that's older adults and folks who don't have a lot of experience with technology. And that's where HOPE app came from. HOPE is healthy opportunities and personal empowerment. And we think that really characterizes our culture and philosophy, our mission, which is to bring tools to the people who most need it, not letting them get it last. So in many cases, technology is developed with with people who have a lot of confidence and experience using technology, and therefore it's designed with complex interface and hard to use, and it doesn't look familiar. And as one of my participants once told me, if I can't see myself, have an avatar with silver hair and silver sneakers, I don't feel like I belong here. And so we wanted to create an experience that made people feel welcome, every person feel welcome who was living with diabetes. So not only could they benefit from those tools, but they could be free from the stigma that affects people living with diabetes as well. So that's how we came to create HOPE app.
And can you repeat it one more time? What HOPE stands for again? I just think that it kind of resonated with me.
Yes. So HOPE stands for Healthy Opportunities, Personal Empowerment. So those are kind of the values that our team really brings to the table each and every day, which is we want to help improve people's health, even in the face of a chronic disease, while putting the power in their own hands, giving them back their life, letting them take control of the situation, even in the face of a chronic disease like diabetes.
I know you mentioned about different ways and different things that you've encountered about solving problems. You want to tell us more about the research project that you're doing right now and how you're looking to solve problems through that?
Yeah, so when we got our funding, we were funded through a special program at the National Institute of Health called the Small Business Innovation Fund. And, historically, if most research is done for knowledge and wisdom, but much of it does not ever get out into the world and change healthcare. The NIH recognized that there were small businesses that could potentially bring good research out to people who need it more quickly, and so they created this SBIR program. And that's where our current funding is from, and it's allowed us to create new features in our platform that make it much more accessible on tools that people have at home, like tablets or small laptops, or even nowadays we're getting close to being able to provide our program on a phone. And this is really incredible because this is a very immersive experience. It's not a headset. It's not the kind where you put on a virtual reality goggles. It's much more about what people can do with the tools they have now, because people need help now. And so we created an immersive experience with the tools that people have available to them. And it's interactive, so they can work together with others and share kitchen table wisdom, the wisdom that they've learned from living with diabetes for a long time with each other. We teach them about how their habits change, about the science and the neurology, the things that are happening in our brains and our nervous system that make it easier to adopt a healthy lifestyle, but also recognizing and validating the support you need to get to the place where now you have a new healthy habit in your life. And we use the technology. We use a construct called the Proteus effect, which says I can practice things that I don't do now, like yoga or mindfulness or exercising in other ways, or just talking with others about my experience in this interactive environment, this way of simulating the behaviors I want to see. And in doing that, I get my brain and my habits programmed a lot faster, and it makes changing your lifestyle easier. And so right now we've created a new platform that's deliverable on tablets, Chromebooks, and we offer a program to get people those tools if they need them. So if somebody is interested and they don't have experience, we can teach them how to navigate tools like digital tools, phones, computers, tablets. We can help people get access to those tools and then teach them how to use them. So part of our mission is digital literacy, and the other part is health literacy, so people can find the ways that work for them. Lots of times people tell me, oh, Dr. Mitchell, I know what to do, I just don't do it. And I think that's what people have come to believe, because they hear the same advice over and over, and they have a hard time putting it into practice. And I think that's because you don't actually have the information and tools you need to make a successful change in your lifestyle and to manage a complicated disease like diabetes. If you did, I think you would do it. I think all of us would. There's a big leap between knowing and actually doing, and it changes over your entire life. And so I always give the example of a souffle. If I told you, Mia, I need you to make a souffle, and here's the ingredients, and here's a cookbook, go for it. Chances are you probably wouldn't be able to make a souffle successfully the first, second, third, or fourth time you do it, because it's much more complicated than it looks in a cookbook. And yet that's exactly what we do, when people are living with a complicated disease like diabetes. We kind of give them tools, and then we send them on their way, and nobody's really shown them how to do it. We tell them to lose weight and do exercise and change their diet, but we don't teach them how to do that on a budget, which is, even harder than just trying to figure it out without those constraints. And many people face challenges to just getting their medication. And so we feel like there's a lot more people need for support to put that information into action in their lives. And it takes a lot more time and commitment. And so we feel like instead of getting 8 sessions of diabetes education, people need it all the time for as long as they're living with the disease, either for new knowledge, to learn about up-and-coming resources, or just for that extra support that people need frequently. And so we created Hope App to change the paradigm of how we support people living with a chronic disease. We want them to be supported all the time. Yet we need to show that that is cost-effective for the people who would pay for that. And generally that's health system leaders and insurance companies and Medicare and Medicaid. They want to know, because they have limited resources to spread across millions of people, they want to know that this is actually going to be a better way to provide care for people. So that's our current project, is to enroll people who have type 2 diabetes. We're seeking to work with older adults, 65 and older, for this particular project, and show that not only will folks be able to participate in the program, that they will benefit from it, they'll actually enjoy it, and that it will lead to better health and better outcomes at a more affordable price than what we pay today in complications, in avoidable hospital visits, emergency room visits, and costly complications. So that's what we are about to embark on in the months ahead. And I would also just like to point out that that's only one initiative. We also welcome any person living with type 2 diabetes who wants to participate in our program, to be part of our program and to enroll with us. We have folks who've been with us for over 5 years who have become kind of like our ambassadors and who continue to benefit from being part of our community. I'll pass it back to you.
And yes, we are working on having some links and having information about your study and the things that you're doing now, link on KIPDA's Facebook page along with our website. So we should have those up and for people to access by next week. So if anybody's looking for those things, they can find them there. But beyond looking at KIPDA's Facebook page or website, where else would they be able to go to find this information?
So you can go to our website, which is www.seeyourselfhealth. That is just like it sounds, seeyourselfhealth.com. And you can also call our phone number, which is 570-505-2228. And our team will be happy to share information with you about our program and how you can participate. We're happy to meet with people in person in the Louisville area. We have a team in the Louisville area or the surrounding counties. We're happy to meet you wherever you're at and tell you a little bit more about our Learn to Earn program. We also offer health coaching to help people work on their own individual goals and to help them get comfortable with our technology platform. We call our group visits meetups, where everybody participates together to learn together, to ask questions, but to also teach each other about what's working for you and to maybe be able to help somebody else that might need it in the future, in their future.
Okay. And again, we're going to have that link on our webpage, which is www.KIPDA.org. And we will also have it on our Facebook page for KIPDA as well. We're going to go ahead and take a short break right now. I really appreciate you telling us about everything, but we'll be back shortly. Let's just take a short break.